Assalamu alaikum. Bismillahirrahmanirrahim. Developing IR training programs in private university hospitals, challenges and opportunities in Pakistan. Pakistan, for everyone, is a land of opportunities, but there are many challenges to be faced in every field of life. There are some demographic factors demonstrating our younger population, which contributes around 60% of total population, aging from 15 years to 64 years. So we are a healthy country overall. Like many developing countries, the healthcare system of Pakistan is a mixed system of public, private, formal, non-formal, and modern with traditional medicines. All are coexisting. Total healthcare facilities are 13,937, including registered hospitals 968 and rural healthcare units 572. Healthcare system is contributed by both public sector as well as private sector. The public sector is governed by federal government and provincial government hospitals. In Pakistan, by law, the health is a responsibility of provincial governments, not the federal government. Private sector has major hospitals with specialized equipment, staff, general practitioners, specialists, dental clinics, surgeon, etc. Pakistan per capita income is only $5,041 per annum, and the total expenditure on health per capita is 129, which is only 2.6% of total GDP. While no official figures exist, experts believe that 25% of this is contributed by the public sector and 75% through private out-of-pocket fee-based funding mechanism. Private sector. Over 3/4 of all healthcare is provided in the private sector for lower, middle, and higher economic groups. Out of the total health expenditure on healthcare in Pakistan, almost 70% is spent in the private sector. On a positive note, however, private sector in Pakistan has set benchmarks for quality of care, enhanced people's access to the health, essential medicines, state-of-the-art diagnostics, and demonstrated a great deal of responsiveness to the health needs of its clients. These are the top 10 causes of mortality in Pakistan, including ischemic heart disease as the number 1, cancer, lower respiratory tract infections, stroke, diarrhea, neonatal encephalopathies, COPD, TB, preterm birth complications, and diabetes. And out of these 10, at least 5 need IR services in tertiary care hospitals. These are the hospitals in private and government sectors providing IR facilities. Most of intervention radiology services are based in private hospitals, except few examples in government. There are a lot of opportunities and need of intervention radiology. For around 200 million people, only few IR facilities are available. These are located in urban areas. None in the rural areas where 65% of our population lives. Most of healthcare facilities lack IR department. Out of 968 registered hospitals, less than 20 have IR facilities. Only 4 IR facilities offer intervention radiology training, including 3 private hospitals and 1 government. Private hospitals are taking lead over government hospitals, probably due to more financial and quality care interests. There is utmost need of development of standard intervention radiology training programs, either in private or government organizations. There are many challenges to be faced, we have only around 40 trained intervention radiologists for 200 million people. Lack of awareness regarding IR among healthcare system developers and policymakers in government as well as private sectors. There is no legislation for IR training, standardization, and registration of expertise. There is lack of awareness regarding intervention radiology in physicians. There is lack of awareness regarding intervention radiology in general public as well. Lack of training opportunities in IR within our country and abroad. Cost effectivity is a major issue for our poor patients. There is lack of inventory provision for intervention radiology due to legislative issues. There is lack of trained nursing staff for IR, limited access of vendors for IR companies to Pakistani market, and low honorarium for fellows. So, an integrated approach to develop IR should be adopted, including awareness among physicians, surgeons, general public, while developing intervention radiology clinics throughout the country, and finally developing good standardized IR training programs. Developing an IR training program is a challenging job in Pakistan. IR training needs to be more matured, needs good number of vascular and non-vascular cases, intrasurgery care setups, needs good quality IR personnel, should have some regulation even if locally assembled. We should have a curriculum for standardization. Intervention radiology training must be certified from recognized organization, college, board or training institute. College of Physician and Surgeon of Pakistan, a very reputable examination board who has national and international reputation, should take the lead to announce a fellowship in subspecialty of intervention radiology under the umbrella of diagnostic radiology. What we are lacking in Pakistan is the leading authority at national level who should identify the faculty who will assume both educational and supervisory responsibilities for fellows, specify their responsibilities for teaching, supervision and formal evaluation of fellows, who should specify the duration and content of the educational experience, who should state the policies and procedures that will govern fellow education during assignment. So the role of intervention radiology of Pakistan, that's why is pivotal and of utmost importance. We hope IRSP would come up with some effective and immediate workings and solutions in nearby future. As far as approach to develop a good IR training program, a strong integrated coordination between IR institute is mandatory to develop a network of IR trainings. Institutes who are already offering IR fellowship must support and appreciate other intervention radiology units to develop and start their training programs. Idea of short IR training in non-vascular interventions is an immediate need of the society. For this purpose, concept of skill labs can be adopted as a pilot project throughout the country. Stipend issues must be addressed because many good hands remain unskilled due to their financial needs. The stipend should be a respectable one, at least equivalent to a faculty position. Along with institutional training, extra institutional opportunities of learning for the fellows must be sought out. Learning gates for foreign intervention radiology training should be addressed, and IRSP and other IR forum like vascular intervention courses, VIC, should play their role for licensing with foreign IR societies. IR vendor companies should support training programs for bringing new techniques, concepts and products in the Pakistani market for the benefit of their own and needy patients. We should develop a career counseling mechanism in our radiology society. We should guide, we should support, we should advise our junior residents who are in training to pursue intervention radiology as a career. To me, the milestone in development of IR training programs would include standardization and policy making at level 1, then development of faculty, then accreditation and integration of IR departments, then quality assurance of the intervention radiology training programs, and finally options for advanced training abroad. These are some guidelines available internationally so that we can adopt them or we can modify according to our local regional requirements. Subspecialty training curriculum for intervention radiology by Royal College of Radiologists, European curriculum and syllabus for intervention radiology, ACGME program requirements for graduate medical education in vascular and intervention radiology, USA. To conclude my talk, Pakistan is a land of opportunity with many challenges in intervention radiology. With such huge population, there is an immense need of good IR services. An integrated and progressive approach is the need of development of IR, including development of intervention radiology clinics, awareness and training programs. A devoted team from trained intervention radiologists must take lead to develop standardized training programs. Thank you very much.